Hello, I am Dr. Manjiri Valsangkar, Director, Bhide Hospital Test Tube Baby Center, Navi Peth, Pune. Today, let us talk about an interesting topic in assisted reproduction. How will we prepare ourselves for the third IUI once we have failed 2 IUI cycles? Now, patients who are ovulating fine, who have everything hormonally normal, their egg quantity and quality seems to be fine on sonographies, and the sperm count and motility is up to the mark, can be assisted for reproduction if they have been trying for an year's time and yet unable to conceive, with the help of a basic technology called as intrauterine insemination or IUI. IUI is a basic technology in which the sperms of the husband are inseminated into the uterus of the lady after the egg ruptures. Now, if a patient has failed 2 IUI cycles, basically we need to understand one thing, that IUI, even in the best of the centers, give a success rate of around 15 to 20%. If we have failed 2 IUIs, your fertility physician will rightly counsel you that IUI gives a good success rate for up to 3 to maximum 4 cycles. There have been research and publications which have proven beyond doubt that beyond 4 IUI cycles, the success rate reduces to as low as less than 2%, and hence that is the time when the advancement in the technology for assisted reproduction is extremely vital. That means you might need to step up for a test tube baby technology. Now, when we are at crossroads having failed 2 IUI, we are here to discuss today what better can be done in the third IUI to prevent a failure. So, in the first 2 IUIs, if there was a ovulation of the egg or not has to be ascertained, whether the egg or the follicle was created properly up to the mark, whether it grew well as per expectation, or was it lagging behind in the growth, did it rupture at the expected time, within how much time of the ovulation was the IUI performed, and was the medicines for the post IUI therapy adequate. So, to answer all this, let us all see this one by one. So, whenever you fail 2 IUIs in the next cycle, what better can be done is, if you have taken only oral medicines in the first 2 cycles, in the third cycle, some artificial support and betterment in the quality of your follicles can be brought about by using artificial injections called as gonadotropins, which have shown to improve the egg quality by another 5 to 10%. So, we can use gonadotropin injections for your IUI cycles in the third IUI cycle. The semen parameters can also be improved with the help of giving motility enhancer medication, and the quality improvement in the semen parameters can be ascertained before proceeding for the third IUI. Obviously, the tubes have been checked whether they are patent or not, either with the help of an HSG or a sonosalpingography or a laproscopy, and we have confirmed that both the fallopian tubes are open and fine. At the time of the IUI, if you have more than one follicle on either side, the timing of the rupture of the injection decides the success of the IUI, and hence instead of going for a regular follicular monitoring, we can assist the patient with additional Doppler studies, which helps us to enhance the quality of the imaging and know the quality of your follicle much better than a regular 2D sonography. When to trigger is an important parameter, and once we trigger the patient, the ovulation occurs. If this ovulation is occurring within 24 to 48 hours, the patient is supposedly fine. In such patients, in the third IUI, you can proceed for 2 IUI cycles in the same scenario, which is known as pre-rupture and post-rupture IUI. After doing the IUI cycles, we can supplement or give some assisted medication for implantation, which is known as luteal phase support or your progesterone medication, which will improvise your success rates by another 2 to 3%. So all in all, if you have failed 2 IUI cycles, don't give up. It is time to re-evaluate, review the things, prepare yourself much better for the 3rd IUI and then undergo the 3rd IUI cycle to prevent a later advanced technology. Thank you.